Did you know there's a connection between diabetes and depression, and that this connection can go both ways? If you or someone you know is diabetic, there's a strong chance for the development of clinical depression. If someone you know suffers from clinical depression, they're also at high risk for the development of type 2 diabetes. Why should this be the case, that depression and diabetes occur twice as much together than they would alone? No one is quite sure, but the research says that both diabetes and depression are associated with brain changes. Changes in the brain that affect the sleep-wake cycle, changes in the brain that affect inflammation, and changes in the brain that affects a particular system called the hypothalamic pituitary adrenal axis. Any one of these systems being disrupted can lead to insulin resistance or hyperglycemia or just plain old high blood sugar. It turns out that when glucose or blood sugar is circulating in our bloodstreams at really high levels, that these sugar molecules are contributing in some ways to the development of not only diabetes, but depression. And when diabetes and depression occur together, they can significantly lower life expectancy above 70 to 80%. So it's really important that if you or someone you love suffers from diabetes, that your healthcare provider is asked to please screen for clinical depression. Also, if you or someone you know suffers from clinical depression, the healthcare provider should be encouraged to ask about diabetes and whether or not the blood test that helps to determine diabetes has been performed. The blood test looks for glucose and it looks at the hemoglobin A1C as markers for whether or not someone is either pre-diabetic or diabetic. It is super important that anyone who has diabetes or depression receives treatment because both of these conditions are highly treatable. This is Dr. Sweet. Thank you.